Good day! We are the second RLA group from Block NF, and we are tasked to talk about pelvic inflammatory disease.
Pelvic inflammatory disease, also known as PID, is an infectious and inflammatory disorder of the upper female genital tract, including the uterus, fallopian tubes, and the adjacent pelvic structures such as the ovaries. It is typically an ascending infection spreading from the lower genital tract. The majority of the cases of PID are complications of a sexually transmitted infection wherein bacteria spreads from the vagina toward the upper reproductive tract. The disease starts with an STD-causing bacteria is on the semen, which enters the vagina. It passes through the cervix and enters the uterus. It later enters the fallopian tubes and ovaries, which then becomes infected. Infections may leave fallopian tubes and spread to other parts of the body. Predisposing factors of the disease that affects the onset of disease are the following. First, we have gynecological surgical procedures such as endometrial biopsy, curettage, and hysteroscopy, which break the cervical barrier and predispose the women to ascending infections. Second, we have having a history of pelvic inflammatory disease or a sexually transmitted infection. Precipitating factors, those modifiable factors that affect the onset of the disease, are the following. First, having multiple sexual partners. Second, unsafe sex or having sexual intercourse without the use of a condom. Third, douching regularly, which upsets the balance if good versus harmful bacteria in the vagina and might mask symptoms. And lastly, use of an intrauterine device, also known as IUD, for birth control. However, the small increased risk is mostly limited to the first 3 weeks after the IUD is placed inside the uterus.
Signs and symptoms may be subtle or mild in some cases, and diagnosis of the disease may not occur until pregnancy or development of chronic pelvic pain. The first sign or symptom is pain, ranging from mild to severe, located in the lower abdomen and pelvis. Second is abnormal or heavy vaginal discharge that may have an unpleasant odor. Third is abnormal uterine bleeding, especially during or after intercourse or between menstrual cycles. Fourth is pain bleeding during intercourse. Fifth is fever, sometimes with chills. And lastly, frequent or difficult urination, pain or burning sensation during urination. If left untreated, pelvic inflammatory disease or PID may progress to further complications. First is ectopic pregnancy. Scarring from PID can prevent a fertilized egg from moving into the uterus. The egg begins to grow in the fallopian tube instead. The tube may rupture or break and cause life-threatening bleeding into the abdomen and pelvis. Second is infertility. Formation of scar tissue, both outside and inside the fallopian tubes, may lead to tubal blockage and infertility. Damage to other reproductive organs may also cause infertility, with the likelihood of infertility increasing each time the patient contracts PID. Third is chronic pelvic pain. PID can cause scar tissue that grows in the fallopian tubes and other pelvic organs, causing ongoing pelvic pain. And lastly is tubo-ovarian abscess. Abscesses may form in your reproductive tract and are more commonly found in the fallopian tubes and ovaries, but may also develop in the uterus or other pelvic organs. Untreated, the abscesses may cause a life-threatening infection.
Nursing diagnosis may be the following. First, we have the acute pain related to inflammation, edema, and congestion of reproductive and pelvic tissues. Second, we have the alteration of comfort related to inflammation, edema secondary to pelvic inflammatory disease. Third, hyperthermia may be related to inflammatory process and hypermetabolic state. Fourth, we have the deficient knowledge regarding cause, complications of condition, therapy needs, and transmission of disease to others. And the last one, we have the risk for situational low self-esteem. Treatment with medicine can get rid of the infection that causes the pelvic inflammatory disease. But there is no way to reverse any scarring or damage to the reproductive tract that PID might have caused. Treatment for PID most often includes the following: antibiotics, which the doctor will prescribe a combination of antibiotics to start immediately. After lab test results, the doctor might adjust the prescription to better match what's causing the infection. It is also important to ensure to take all the medication even if the patient starts to feel better after a few days. Second, treatment for the partner. To prevent reinfection with an STI, sexual partner or partners should be examined and treated. Infected partners might not have any noticeable symptoms. And the last one is the temporary abstinence. Avoiding sexual intercourse is important until treatment is completed and symptoms have resolved. If the pregnant is seriously ill, have a suspected abscess, or haven't responded to oral medications, hospitalizations might be needed. The patient might receive intravenous antibiotics followed by antibiotics taken by mouth or oral. Here are the following recommended procedures or ways on how to reduce the risk of having PID. First is we have to practice safe sex, talk to a doctor about contraception, get tested, request that your partner may be tested. Don't douche, as douching upsets the balance of bacteria in the vagina.
There is no one test that can accurately diagnose pelvic inflammatory disease. Instead, the doctor will rely on a combination of findings from laparoscopy. During this procedure, the doctor inserts a thin, light instrument through a small incision in the abdomen to view your pelvic organs. Ultrasound. This test uses sound waves to create images of the reproductive organs. Blood and urine tests. These tests may be used to test for pregnancy, HIV, or other sexually transmitted infections, or to measure white blood cell counts or other markers of infection or inflammation. Pelvic exam. During the exam, the doctor will check the pelvic region for tenderness and swelling. The doctor may also use cotton swabs to take fluid samples from the vagina and cervix. The samples will be tested at a lab for signs of infection and organisms such as gonorrhea and chlamydia.